Hello, I'm Arun Krishna, one of the consultant colorectal surgeon, work at South Tyneside and Sunderland NHS Foundation Trust. Today I would like to give an overview about bowel cancer, how we diagnose bowel cancer, what type of treatment available in our South Tyneside and Sunderland NHS Trust. What we mean by bowel? Bowel is a part of the digestive system. Bowel has got two parts, small and large bowel. Large bowel is made up of colon, rectum and anus. Any cancer arising with these three areas we called as bowel cancer. You might wonder, do I need to know about bowel cancer? Yes, of course, because it's the second biggest cancer killer in the UK. It's the fourth most commonly diagnosed cancer in the UK. You can imagine 41,000 new patients are diagnosed with the bowel cancer every year. What it means is 1 in every 13 minutes, someone in the UK gets a diagnosis of bowel cancer. More importantly, 16,000 people die of bowel cancer each year in the UK, which is again 1 in every 22 minutes, someone loses a life related to the bowel cancer. I have given you enough bad news. Let me give you the good news. If you diagnose bowel cancer particularly early, it's treatable and curable. If you diagnose it in a very early stage, there's a 97% chance of cure rate. If you diagnose it delayed, it reduces to 8% of survival. So it's really important we aim to diagnose bowel cancer early. What causes bowel cancer? The true answer, no one knows the exact cause. Lots of research going on, but few things we know, what we call risk factors. What it means, factors which can increase the chance of a person developing bowel cancer. Having one or more does not mean you will definitely get bowel cancer. In the same way, if you do not have any risk factor, it doesn't mean you will not get bowel cancer. Let's focus on what are all the risk factors. Bowel cancers are more common in older people. Risk increasing with increasing age. Usually it starts around 50 or over. 4 out of 10 patients are aged 75 or more. At the same time, bowel cancer can affect people of any age. Let's look at the diet. Eating red meat, processed meat, fried or grilled meat increases the risk of developing bowel cancer. I'm not saying we shouldn't eat meat at all. The current UK guidelines allows us to eat not more than 70 grams per day. Not eating fruits and vegetables increases the risk of developing bowel cancer. What about physical activity? Being not active increases the risk of developing bowel cancer. Being overweight, especially in men, definitely increases the risk of developing bowel cancer. Those who smoke has got increased risk of developing bowel cancer. If you have a type 2 diabetes, you have a slightly higher risk of developing bowel cancer. Having an inflammatory bowel disease, what we call ulcerative colitis or Crohn's disease, increases the chance of developing bowel cancer. Irritable bowel syndrome is not an inflammatory bowel disease. There is no link in developing bowel cancer. IBS, what we call irritable bowel syndrome, is not an inflammatory bowel disease, and there is no risk associated with developing bowel cancer. What about family history? Having one family member who developed bowel cancer at an older age does not increase the risk for you. If several close family members on the same side of your family have had a bowel cancer, or if a close family member had bowel cancer before the age of 50, increases the risk of developing bowel cancer. Most people who get bowel cancer do not have a family history of it. You might ask a question, is it because of the faulty gene in my family? No, faulty gene is a very rare cause for developing bowel cancer. If we diagnosed 100 bowel cancers, only 5 of them are caused by a faulty inherited gene. There are only 2 rare conditions that can run in families, what they call Lynch syndrome and familial adenomatous polyposis. We'll look at these type of syndromes in a separate video. Let's focus on the symptoms you need to be watchful of. Bleeding from the back passage, bleeding in or on the poo, a change in your normal bowel habit that happens for no obvious reason and lasts longer than 3 weeks. For example, diarrhea, constipation, or alternating diarrhea and constipation. Feeling that you have not emptied your bowel properly after you poo. Unexplained tiredness, dizziness, or breathlessness. Unexplained weight loss. Unexplained low blood count, what we call anemia. You need to be watchful of it. Sometimes cancer can cause a blockage in the bowel. You may feel constipated, bloated, have a tummy pain, or you might feel sick. These are all symptoms of blockage in the bowel. I also would like to make you aware these symptoms can be caused by conditions other than colorectal cancer. The important message I would like to convey is, if you have any of the symptoms I described, you should always have them checked by your doctor. Your doctor will decide whether you need to be referred to a specialist in the hospital. Thanks for watching this video. If you need any further information, please feel free to contact us.